All right, so the September-October topic for 2021 in Lincoln Douglas is resolve the member nations of the World Trade Organization ought to reduce intellectual property protections for medicine. The WTO is an intergovernmental agency. So, in debate, you'll hear about governments as agents, you'll hear about non governmental agencies as agents, and sometimes you'll hear about elements of government, like the judiciary or the executive branch or the legislative branch, as agents. In this case, you've got an intergovernmental agency, such as the UN, except the World Trade Organization does a lot more purposeful stuff than the UN ever does. So, what is the WTO in terms of its members? Well, it comprises 160 plus nations, 160 nations with 20 nations currently trying to get in. It includes developed nations like the United States and nations in Europe, and it includes developing or underdeveloped nations like Uruguay and stuff, you know. The institutional specifics of it are basically it's an organization that tries to standardize things like tariffs and tax rates, and to ensure that global commerce has some sort of regulatory framework, basically. The status quo. In the status quo, there are certain kinds of intellectual property protections for things that are not medicines, and there's a different set of standards for medicines. This is true in the United States with domestic law, and it's true in the World Trade Organization already. The last World Trade Organization rules change on this issue was in 1994. However, the reason we're debating this topic now is because the WTO came out with a 320-page PDF on the issue of IP in medicine in 2020 in response to COVID. Interestingly, the World Trade Organization seems to be one of the only organizations that has kind of had an intelligent response to the whole COVID thing, which we'll get into in a little bit. Because, of course, their concern is trade, not public health as a overarching concern. So, the thing to remember is that even among WTO member nations, there's not always going to be a uniformity in terms of the application of the rules. So, like I said before, there are developed nations and developing nations and underdeveloped nations in the WTO. In general, the WTO tries to be progressive in some sense. Like, for example, even if it's a good idea for there to be reduced IP protections for medication, let's say the country of Ethiopia has a particular ingredient that they can get from their land that's hard to get other places. But Ethiopia doesn't really have a lot of other sources of income. Well, the WTO might say, well, you can keep your tariffs because you need this income, where even though the rule specifies for things like this, you shouldn't keep your tariffs. So, in other words, the WTO rules are created in sort of nuanced ways that makes a general statement like the member nations of the World Trade Organization ought to reduce intellectual property protections for medicines a little bit problematic. So, for example, one way you could run a counterplan in this topic is to say the member nations, except for developing nations, ought to. Because in those developing nations, you have to afford them every opportunity to maximally profit from those commodities and resources that they have. All right, so let's look at the metaframing issue next. So this resolution is a Lincoln Douglas resolution, and yet it would seem to imply a plan text almost. The member nations ought to reduce intellectual property protections for medicines. So it doesn't specify exactly how to reduce them, but it reads kind of like a topic area, which sort of begs for a plan text. Yes, we ought to reduce the number of years for which a given pharmaceutical company has ownership over the patent of a given drug from 7 years to 2 years or something like that. Would be a plan text that would make some sense with this resolution. However, there's a problem with the WTO as an agent. The WTO is afforded almost only as much authority as the member nations choose to afford it. There's a lot of signees or signatories to this organization. In other words, a lot of members, but at the end of the day, each country is a sovereign nation. So if an ambassador from the U.S. signs some WTO agreement, there's nothing to stop somebody like President Trump, who got us out of a shit ton of these agreements, from just saying, no, we're pulling out of it after all. And that makes it difficult to fiat the World Trade Organization as an agent that can produce policy that has kind of predictable results. However, generally speaking, it's not the case that the signatories of these agreements and stuff violate them, so it probably isn't going to be a determinant point in the round. If you wanted to take a plan-based approach to an affirmation here, you certainly could, and probably a wise plan-based approach would be to specify a minor reduction in intellectual property protections, sculpted to minimize the impact to research and development, which is really the primary negative argument here, or the main engine of the negation is going to be pharmaceutical companies create new drugs because there's financial incentive for them to do so. If upon creating these new drugs, they only have control over them in the marketplace for a brief period of time, say 6 months, it may cease to be the case that it's profitable for them to engage in the research and development in the first place. And if we don't have pharmaceutical companies researching and developing new drugs, then when something like COVID hits, there's nobody in place to come up with a vaccine or something, right? Now, of course, it turned out that the vaccine was useless. Because if it had been useful, I wouldn't still have to wear a mask. It would have solved the problem. Or we would have framed it correctly. We would be saying now, those who wish to avoid getting sick are welcome to wear a mask. I don't object to anybody else wearing a mask. I don't force them not to wear a mask. Anyway, a little bit of a sidetrack there. So, of course, you could take a non-plan based affirmation that still sees WTO as an agent, which basically says, yes, the WTO is going to change policy. Yes, I'm going to fiat that. Yes, I'm going to count all the impacts that I predict happening as a consequence of this, but I'm not going to specify exactly the manner in which these intellectual property protections are actually going to be reduced. So that would be a non-plan-based affirmation with the WTO still as an agent. Now, if you want to do an agent-free affirmation, that's certainly possible as well, because this is Lincoln Douglas, so it's supposed to be values debate, and it means you can do a whole resolution kind of affirmation. If you're trying to do a whole resolution affirmation, then you're probably going to have as your framework either a straight up normative framework or simply a preponderance of the evidence supports the truth of it, a compare worlds kind of a criterion. If you use a compare worlds criterion, you say, let's compare the world after the affirmation to the status quo, and the world after the affirmation is better, and that's all we need to do to win. So that would be sort of an agent-free affirmation in the sense that you're still fiating the impacts, but it doesn't really matter who the agent is. The fact that it's the WTO is incidental in this approach. So let's go on to number 4, framing. So if you're going to frame this on an AF ground, you'll probably frame it prescriptively. But if you wanted to frame it normatively on AF, you'd probably need to focus on the entitlements part there, or intuitive norms. That one intuitive norm that people tend to affirm is that everybody has, quote unquote, the right to fresh, clean water, health care, food, shelter, basic necessities. Now, that's obviously not the case. People don't have the right to any of those things. But it may be the case that a just society entitles people to those things. We know that they don't have the right to those things because if I had the right to fresh, clean water, then I could sit in the middle of my room here, never get up and get myself a glass of water, die of thirst, and somebody would be guilty of murdering me. That's what it would mean if I had the right to fresh, clean water. So I don't have the right to it. Do I have the right to medicine? No. If I did, it would mean, again, if I sat in the middle of my room and refused to get up and take any medicine, that somebody would be guilty of murdering me. So we know it's not a negative right like that. But most people would agree that a just society minimizes the suffering of the majority to the extent that it can with its protocols and structures. That in an ideal society, everybody has at least a minimum standard of living that includes the basic necessities. Food, shelter, healthcare, I guess, is a basic necessity. In Scandinavian countries, they think internet's a basic necessity. So, I mean, I do too, but I don't expect the government to give it to me for free. So what ends up happening then is if you're appealing to those entitlements or intuitive norms, you're going to have to use functionally an impact calculus or a prescriptive framework to impact it. And the impacts on the AF side are going to be measured in these, well, the impacts in general are going to be measured in these three terms, in these three mechanical terms, and the total impact is going to be measured in lives saved or lost. Okay. So I need to put that on there. Lives. So this would be like impacts mechanical and in terms of impacts that are measurable or countable. It's the same two impacts that it always is, which is lives and dollars. Now, the thing is, dollars really means, damn this number 4. Dollars really always means the same thing. It means standard of living. It doesn't mean dollars. Exactly. So it's generally considered that a more robust economy offers a higher standard of living, and that the protocols that interfere with the naturally occurring commerce between people are things that reduce the standard of living, although they may also be things that quote unquote save lives. So now I'm going to read the crystallizations. I'm going to ask you, Chloe, if you have any questions. The AF on this resolution is pretty wide open. One might, for example, over-affirm by critiquing the very idea of intellectual property. And then you could retreat to, so you over-affirm, make them tackle the broad issue of intellectual property, and then retreat to defending just the intellectual property you're tasked to defend here. In contrast, one might also run a very narrow plan text that reduces the existing protections minimally and in ways sculpted to help the AF win an impacts calculus, and either might be a very good strategy. Partially, this is because of the muddled issue of agency. Presumably, any plan text would specify the WTO as agent, but each of the member nations is sovereign, and there's no guarantee that WTO policy will actually be respected by each of the member states. AF only has fiat for one agent, of course, so it's not possible to affirm that multiple nations do anything if one takes a plan-based approach. LD, though, is value debate, and many successful AFs will simply take a whole resolution approach, affirming the truth of the resolution overall, while avoiding any specifics about the implementation of the plan implied by the resolution. On neg, and I was writing this, and then I had to start the session here, but on neg, the approach to negating is going to obviously be dictated a lot by the approach to affirming. But if you want to make sort of an independent negationary case, you'd probably be wise to argue that. Well, I try to turn COVID, perhaps, is one thing you could do. But we'll explore more about what we can do on neg in a little bit. First, before we go any further, based on just this initial outlined topic lecture, do you have any questions?
I don't think so.
Okay. Well then, let's look at the next document I want to look at, which is the 1994 Pharma Agreement. It's called the WTO's Pharma Agreement. Do you see it?
It's a document.
Yeah, it's a doc I shared with you.
What is it called?
It's called the WTO's Pharma Agreement.
Oh, yeah, I see.
Alright. So, I'm going to read some of this out loud so that we get a sense of, this is the last active policy on pharmaceutical products that attempted to differentiate them from regular products. So if I'm selling flash drives, the WTO doesn't think that qualifies as one of those normative things, right? So like, if I'm providing a technology that will allow people in Africa to make their water very clean, then the WTO is going to say, well, what can we do to make this thing actually affordable for the people who need it? Because there's a normative element to it. It's like, for example, if there's a natural disaster and I'm a store, and there's a rush on the store to try to get water, and I'm the only store that has water left because I've jacked up the prices to $50 per gallon. And then, because of the emergency nature of the thing, people pay the $50 per gallon. After the fact, I will be accused of gouging. That is to say, it's not considered morally acceptable for a business person to take that much advantage of a pressing emergency need. A business is expected to be more community minded than that, I guess. So anyway, this is the 1994 Agreement on Trade in Pharmaceutical Products. It eliminates tariffs and other duties and charges on a large number of pharmaceutical products and the substances used to produce them, permanently binding them at duty-free levels. Concluded during the Uruguay round of trade negotiations, the agreement was signed by and applies to only a group of participants who also committed to implement the outcomes on a most favored nation basis. Canada, the European Union, Japan, Macau, Norway, Switzerland, the United Kingdom, and the United States currently participate in this agreement. These are the products covered by the agreement. The concessions agreed to in the negotiations are incorporated in the WTO's schedules of concessions of the participating members via the 1980 procedures for the rectification of schedules. The items covered included finished pharmaceutical products designated by their harmonized system codes, and this includes products classified or classifiable in HS Chapter 30, products classified or classifiable in HS headings 29, 36, 37, 39, and 41, except for dihydrostephomethane and salts, esters and hydrates thereof, pharmaceutical active ingredients, and chemical compounds used by the pharmaceutical industry, enumerated in 4 annexes and designated by a combination of HS codes, product description, chemical abstract service codes, international non-proprietary name codes managed by the World Health Organization to facilitate the identification of pharmaceutical substances or active pharmaceutical ingredients. As a result of the 1994 agreement and subsequent reviews, participating members committed to eliminate customs duties and all other duties and charges not only on all pharmaceutical products, whether sold in bulk or in dosified packages for retail sale, but also on over 7,000 pharmaceutical active ingredients, etc. Now, we're going to read this last paragraph here, and then we'll go on to the next document. Trade in pharmaceutical products. International trade in pharmaceutical products has experienced dynamic growth since the adoption of the pharma agreement. Imports of finished pharmaceutical products have grown by almost 14% over the last 20 years, imports valued at more than $350 billion in 2018. Trade in pharmaceutical active ingredients and chemical components has also grown steady. Obtaining tariff and import statistics for these products can be a complex exercise. Pharmaceutical active ingredients and chemical components used in the production of finished pharmaceutical products do not have common HS codes. Moreover, chemical substances such as carbon or chlorine may be traded and used for a variety of purposes, not only for pharmaceutical production. Nevertheless, global imports of these substances have risen continuously over the last 25 years. So there's an implication here in the last paragraph that this 1994 agreement may be dated. That, in other words, that it may need to be updated, and that brings us to the big document, which we'll go over a bit here. And it's called WTO WTO 2020E. You can open it in Google Docs, where we can cut from it if we want to. But it's probably easier to read as a PDF. So you might want to open it as a PDF instead. And I want to go over some of this stuff here, because this is why this resolution is the resolution. It's because of this PDF.
Okay, I have this on.
All right, try opening it as a PDF. Do I have it shared with you as a PDF or no?
No.
Well, let me share it with you then. And we'll learn a lot about sort of the component parts of this topic just by first looking at the table of contents here, which basically articulates all the different argumentational issues that might come up. Okay, so medical technology is the fundamentals. Public health and medical technology is the imperative for international cooperation. So this section 1A here is basically a section of this PDF that's about inherency. Do you remember what inherency means, Chloe?
No.
Okay. Inherency is the principle that if you're going to advocate a change to the status quo, you need to articulate a problem that won't solve itself. So, for example, here's an app that doesn't have any inherency. Jeffrey and Chloe go to the amusement park, and it turns out Chloe is too short to ride on the big roller coaster. Jeffrey advocates a plan text. He says, let's take Chloe to the hospital and have her legs chopped off and put in leg extensions to make her legs longer, and then put the legs back on the leg extensions, and that way she'll be tall enough to ride the ride. But Jeffrey and Chloe's mom point out, Jeffrey, that plan text has no inherency, because if we do nothing, Chloe will grow tall enough on her own. We don't need to take any action. It'll solve itself. So that's one way in which you might not have any inherency. Another kind of app that doesn't have any inherency is one that doesn't have any obstacle to preventing it from being implemented as it is. So, for example, if I said, in order to minimize crime, my plan text is, everybody just be cool. Well, there's no inherency there, because there's nothing stopping everybody from just being cool now that I'm solving, right? If there were an anti-coolness barrier that I had a policy that solved, then that would have inherency. But there's no anti-coolness barrier, so it doesn't have inherency, okay?
Okay.
So when it says here, A, public health and medical technology is the imperative for international cooperation, that the imperative for is essentially saying, here are your inherency arguments. And the cooperating agencies, this is your, these are what are known as stakeholders, which is parties that are relevant parties to the discussion. So in other words, the three main organizations here articulated are the World Trade Organization, which is the agent for this topic, but also the World Intellectual Property Organization, which presumably has plenty of opinions on what intellectual property law ought to look like, and number one, the World Health Organization. So if you're talking about the World Trade Organization, presumably it's interested in bridging the distance between 1 and 2. The World Health Organization doesn't care about profits. The World Intellectual Property Organization probably doesn't care about people very much, and the World Trade Organization is intended to care about both. All right, so that's just sort of background information, and in other words, agent muddling possibilities are to be found there. With C, the global burden of disease and global health risks, again, this is partially an inherency argument that, in fact, this is a big risk, or maybe it's not, that requires us to change the status quo so that when this risk becomes manifest, our status quo is more well adapted to it to save lives and preserve the common good. D, factors shaping public health policy, seeking effective outcomes within a complex policy environment. So, in other words, that D number 1 there is a negation, is an agent specificity negation, basically. It says, because the AF can't specify an agent here, they can't count impacts of a change to the status quo because there needs to be an agent that changes that status quo and they fail to specify it. Or if you do specify an agent like the World Trade Organization, you could run D1 as a agent specificity critique that says you either pick the wrong agent or that agent doesn't have the jurisdictional wherewithal to accomplish the affirmation of the resolution. And then it talks about sort of the interest in, desire to, efforts to attain uniformity among the various sovereign nations' policies such that they can have more control over trade rules, basically. All right, so Section 2, the policy context for action on innovation and access. So this is going to be covering one half of the normative aspects of things, as to say what's right and wrong, health and human rights. So this is going to get into that issue of, do people have the right to an entitlement? Access to essential medicines, an indicator for the fulfillment of the right to health. There is no right to health, of course. And this is really sloppy language that's been normalized by the EU and stuff. We can speak honestly about things and have a real conversation about it. You don't need to misuse words. There might be a just entitlement to health, but there is no right to health. If there were a right to health, then every time I get sick, somebody is to blame. Somebody is liable for that. Universal access and the UN Sustainable Development Goals. So, of course, the WTO wants to tie in also with UN agendas, public health innovation and access in the WHO, and the World Health Organization, cross-cutting efforts to tackle antimicrobial resistance. So, in other words, there's a concern, and it has been for a long time, about antibiotics being overused and infectious diseases becoming resistant to those antibiotics, so that there are fewer and fewer options for doctors in treating certain kinds of infectious diseases. So in other words, there's a concern about access to medicines, but there's also a concern about over access to medicines, because it can have negative impacts as well. Regulation of health technologies. All right, so now in B now we start talking about the pharmaceutical side of the argument, which is intellectual property systems, competition law and policy, trade policy settings, government procurement, free trade agreements, resolving trade disputes, the WTO. So it should be noted here at this point, in the 1994 Pharma Agreement, that was an agreement that reduced the amount of profit and income and monies received by governments, not by the pharmaceutical industries. So the 1994 agreement was about tariffs and taxes and stuff. It was not about how much pharmaceutical companies can profit from the things they create, nor for how long. As I indicated, I think already, in the United States, the amount of time that a drug company possesses the patent on their drug is smaller than for other kinds of products. And there's also, of course, a bigger, more extensive approval procedure because back in the 70s or late 60s, there was this drug called thalidomide, which was rushed into production as a treatment for morning sickness for women who were pregnant. But it ended up causing their babies to be deformed. And there was a big uproar over it. And after that, in the U.S., the FDA started implementing a much more rigorous protocol for testing and approving medicines. Okay, so the thing is, there are also free trade agreements. So to what extent are these changes in intellectual property rules for medications going to be in conflict with the existing agreements, and how and which of those agreements is determined to be determinant about the policy, given the fact that these agreements are generally intergovernmental. In other words, each of the parties is sovereign, and there's a reliance on trust, therefore, to fulfill the agreement. So C is economics of innovation and access to medical technologies. D is genetic resources, traditional knowledge, and traditional medicine. So traditional medicine knowledge systems, traditional medicine knowledge and health and IP policy. This will be an interesting possible way to negate. So if, let's say you're a tribe of savages in the Amazon jungle, and you've created a traditional medicine using the secretion from some kind of frog, and it works great. Well, because you haven't synthesized it in a lab, you have no ownership over it. Whereas the pharmaceutical company can synthetically create the same exact thing, and then they own it. So that's covered here in concerns about misappropriation of traditional knowledge and genetic resources, and new approaches to IP protection of traditional medical knowledge. So in other words, number 4 is going to be a negationary argument for D4 here. You're going to argue negation on the grounds that it's oppressive towards savages in the jungle. And what? That's offensive to call them savages? I'm pretty sure it's not. 5, new approaches to IP protection of traditional. So this number 5 is going to be the answer to that neg argument. Number 4. Okay. Now let's look at number 3. Medical technology is the innovation dimension. So, A, historical pattern of medical R&D. This is going to give you plenty of examples of how the status quo system of intellectual property and control and ownership over new drugs by pharmaceutical companies has in fact produced a slew of new drugs that solve all kinds of problems. So this is going to be sort of a historical framework that you could use as there's a precedent for the status quo working. It would be a negationary block. B, the current R&D landscape. This would probably include a lot of responses to that negationary block, which is to say, well, that's how it used to be, but it's not like that anymore. A time of challenges and opportunities, the key role of public sector research. So again, another factor that complicates when you're talking about pharma is that sometimes the government subsidizes certain kinds of research and development in pharmaceutical areas because the government has taken on to itself the idea that it has an active, not just a passive, responsibility for public health. And what I mean by a passive responsibility is a passive responsibility of public health is one in which the government reacts to threats as they arise, whereas an active one is it's actively trying to prevent them ahead of time. Medical R&D costs. So that's going to be something that's critical to probably the neg argumentation, is that in the status quo, pharmaceutical companies are investing huge amounts of money into research and development, and if they don't get that back on the other end, then they'll stop investing thusly. And that's going to be covered in the incentive models in the innovation cycle. So in other words, is there any other incentive to innovate drugs besides the fact that your pharmaceutical company can get rich? And of course there is. There's been lots of drugs developed by people who, in the past, who weren't looking to cash in on it necessarily. Individuals are different, companies are different, people have differing degrees of understanding of their own positive moral duties. Some people think they have an affirmative duty to do good. Others think they just have a negative duty not to do wrong. And that's going to play out in your company too, if you own a company, There are companies that are more actively attempting to be good corporate citizens, quote unquote. Let's say more altruistic. And there are companies that think the best altruism is serving their shareholders in the bottom line. All right, so C, overcoming market failures in medical product R&D. One of the strong arguments against changing the status quo is that if I research and develop a product that doesn't come to fruition, in other words, it doesn't turn out to work, then that's just money lost. So it's important to remember that for every drug that a drug company gets a patent on that lasts 6 or 7 years, they have multiple failures they've invested money into as well, because R&D fundamentally requires some trial and error. Diseases disproportionately affecting people in developing countries. That what they mean here is, as a market failure, is there's no incentive for a pharmaceutical company to develop a drug to treat a disease that only poor people have, because poor people can't pay very much for their drug. Unless shit tons and shit tons and shit tons of poor people have it, or unless the pharmaceutical company can assume that some intergovernmental agency or governmental agency will purchase their drug from them for the purpose of treating these people, which is typically how it ends up playing out. The WHO R&D blueprint for action to prevent epidemics. So that's going to be specific about COVID-y kind of things. WHO expert, and that's again, this is World Health Organization. So now they're referencing the World Health Organization and the World Intellectual Property Organization in this section here. Novel approaches, product development partnerships, research for neglected diseases. So these are all alts to the status quo that will allow the affirmation to say, no, I'm not, affirming won't cause all these catastrophic problems that you say it will, because the status quo financial incentive approach is not unique to is not the only approach that is used. So because in the status quo there are multiple approaches towards funding research and development, if we lose some of the research and development by changing the status quo in the intellectual property area, we'll still have enough research and development. Okay, so this says WIPO regarding search, mobilizing intellectual property for global health, research for neglected diseases, product development partnerships. So there's a lot of specs there that we could use in building a case. So now, do you hear looks at the issue of just how much do intellectual property rights play a role in the innovation cycle? Innovation cycle meaning coming up with new drugs. IP management within the broader legal and policy framework at national and international levels, intellectual property in the product development process, patent filing strategies in public and private sector, and the exercise of patent rights, pre-grant issues, questions of patentability, post-grant issues, questions related to the use of patents. So, of course, here's the thing. In the olden days, patents existed because if I created, say, the Polaroid camera, like Kodak did, then it's believed that other people shouldn't be able to just copy my invention and sell the same thing for cheaper because I'm the one who invented it. But that shouldn't last forever. So, in other words, it's not the case that whoever invented the wheel should still be getting royalties every time anybody uses a wheel, right? But maybe it is the case that somebody who invents something brand new like a Polaroid camera should have a monopoly on it for a stretch of time, since they spent all the time and energy creating the idea. They should have sole access to profits from it for a stretch of time. The same principle is true of copyright, and it makes more sense with copyright, really, because if I write a book and I want to sell it to somebody, like a publishing company, and they publish it, if anybody can just publish anybody can publish my book and sell copies of it, then there's no way for me to profit from it, right? So there's an example of flu vaccines and stuff in E that could be used to either say the existing, access is adequate in the existing status quo, we don't need to change anything, or it could be used to say that we need to change it to be more like we treat influenza viruses or something like that. So the context: the health systems related determinants of access. Number 1, universal health coverage. Number 2, international access frameworks, the value chain of medicines and health products. 3, the meaning and measurement of access. 4, generic medicines policies, price controls, and reference prices. 5, taxes. 6, markups. 7, rational selection and use of medicines. 8, effective and efficient procurement mechanisms. 9, sustainable financing. 10, manufacturing and technology transfer. 11, regulatory mechanisms and access to medical technology. 12, substandard and falsified medical products. Okay, and then they cover specific areas of health concern. Now note, the context here assumes a frame of reference that's false, which is that people have a right to universal health coverage. And to make it not false, all they have to do is speak correctly and say people have a just expectation of an entitlement to it. Then we can talk about it in a serious way, but people don't use language well because they're stupid. Intellectual property related determinants of access. Determinants of access prior to patent grant, pre-grant and post-grant review procedures, post-grant determinants of access, patent information and its relationship with public policy, review of relevant provisions and free trade agreements. So 252 here, you're going to get the status quo articulated specifically towards the topic. D, other trade-related determinants of access, international trade and tariff data, competition law and policy. All right, so you can see here that in addition there's an Annex 1 which talks about relevant resolutions of the United Nations, relevant resolutions of the United Nations Human Rights Council, and then so it goes from broader to more specific. So first there's relevant resolutions of the General Assembly. Then there's relevant resolutions of the Human Rights Council. Then there's relevant reports of the Special Rapporteur on the Right to Health. Again, there is no right to health. By any meaningful understanding of the word right, there is no right to health. So that's one of the ways in which you could do a neg critique here. You could do a critique of the metaframe that is operant in this document, and obviously that under which everything is argued by the WTO and the WHO, and say that, we can't possibly affirm something predicated on so fundamental a flaw in reasoning as to misuse the word right when they mean entitlement. So that's a possible neg approach. Okay, so that's about as far as I want to go in this topic lecture today, except to ask you if you have any questions. Do you have some questions?
I think I understand it all. I'm not quite sure how to do that.
Yeah, okay. Well, the thing is, this is just an opening topic lecture, and when we work again next time, we'll start to put together a couple default AFs that are just sort of the main basic issues, and we'll start to put together some neg packs to attack different kind of AF approaches, and maybe some neg offense that's independent of the AF. Okay?
Okay.
Alright, so that was only 45 minutes, but that's all I got for today. Alright, Chloe, so see you later.
Bye.
Bye.